got some good news for you. Amen. Hey, everybody, gather near. The doctor's in the house, so lend him your ear. The things he can say might even make your day. He might even help your pain go away. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house. Doctor is in the house.
Oh, yeah, ladies and gentlemen, the doctor is in the house. This is Dr. Ron, host of Dr. Ron, Unfiltered, Uncensored, with today's episode 455. And I think we're off a few. I think we have more than this. Well, welcome, everybody, and I do welcome you with an attitude of gratitude. Gratitude is such a fantastic emotion that is measurable by the amount of hormones it releases. I hope everyone is doing good out there. I am just back from a stay up in Pennsylvania, again, visiting another hospital and seeing the ravages of Parkinson's disease. And we'll get to that with a real good program with specialists in Parkinson's, which will include Dr. Will Wong, because it is just devastating, and how this disease does depend on pharmacological treatment. Okay, there are some root causes that no one talks about, like drinking well water in a farm area and exposed to pesticides and herbicides and toxins. And, we are exposed to more and more toxins every day. We have physical toxins. I've talked to you about them. The radiation, the chemical toxins, the plasticizers, the pesticides, the benzene, and we have biological toxins now, viruses and bacteria. There's another type of toxin that, again, it requires a whole podcast, and that's emotional toxins. And as many of us know, they could be more harmful than physical or biochemical toxins, because why? They're always with us. Sometimes we lose sleep over it, and they bug us. So we have to realize that our health is like money, ladies and gentlemen. Like Josh Billings said, we never have a true idea of the value of health until we lose it, like money. So health is like money. Think of that. We never have a true idea of its value until we lose it. And 1 billion people now have chronic diseases worldwide. 80% of people over 65 have at least one chronic condition. Is there any reason, any wonder why we spend so much money or going broke in this healthcare industry, controlled by the big pharmaceutical companies? And, we have a lot of these things that nag us, and we just put it off. We have some high blood pressure, diabetes, we're overweight, we're obese, we have some arthritis pains, chronic pain, we have high cholesterol. And nobody talks about the root cause of high cholesterol. No, your physician will just say, we'll give you a drug. And they give you a drug which lowers your vitamin D, gives you Parkinson's disease, gives you diabetes. And if that doesn't work, we'll add more. We have Alzheimer's disease and dementia. Nobody looks at the root causes. Could it be the drugs you're taking? Could it be the anticholinergics, the antidepressants? And how many people over age 65 are lonely and are socially isolated? That's a cause of chronic symptoms. You get addicted to drugs and drug use. You get put on one drug, you have a side effect of that drug, which most physicians don't even read the package inserts, but they'll give you another drug to get rid of that side effect. And then you have another symptom, they'll give you a drug for that, rather than getting to the root causes of your problem. And that's why I've been talking about the Rockefeller allopathic medicine that most of our MDs today are trained in, controlled by the big pharmaceutical companies. So what do? Well, we have to take control of our health. Like I've been telling you for years, you have to be the CEO of your own body. If you have a leak in a pipe and you just keep mopping the floor, that's, the same symptoms are going to come back until you fix that leak. And we do spend a lot of money on healthcare. And our doctors, we go to our doctor and he looks at his tablet, or his nurse came in, gave him a list of the drugs you're taking. And how many physicians take the time to look if any of those drugs are reacting with one another? So big medicine today is technology and owned by corporations where most of the physicians are employed. And some of our natural health practitioners are following that model and saying, well, you should take St. John's wort for this. You should take valerian root for that. Well, that's no more than putting Band-Aids on it. We need to get the body perfectly balanced. So are doctors taught how to cure people? Well, they are, but how do they care for people? Is anyone happy with the health care these days? Or do you see your friends and relatives getting sicker? And how many of them are going near bankrupt from all the medical bills? And how many doctors are complaining of burning out? And when they get that tired and don't like what they're doing, how many of them make mistakes? So is our healthcare system maybe dysfunctional? So that's why we've been doing these programs about health coaching, how to take care of yourself, giving you information. But if you don't act on that information, it doesn't do any good. So today, because I've been just back from seeing how the healthcare system again works in a different hospital, I can tell you that very few physicians are in hospitals these days. It looks to me, and when I look at bills of different people that ask me to check them, most of the charges is for licensed physician's assistants. There was one hospital I was in last month where there was no physician, just a hospitalist, and the hospitalist changes daily. And a physician assistant took over most of the care. So today, I just want to talk a short time about vitamin D because one of my listeners did bring up to me the fact that they saw an article about vitamin D aggravating dementia. A very essential vitamin that has been shown, if it's low, you're more susceptible to that Chinese epidemic, and a lot of other things that go wrong when you're low in vitamin D. So, vitamin D can cause muscle weakness. It can cause fatigue. It can cause you to have trouble sleeping. It can cause you to be anxious, cause you to have weakened bones, a weakened immune system, and inflammation, right? And those of you who have listened to me know that inflammation is the base of most chronic diseases. And there's estimates that 40 to 80% of adults in the United States may suffer from a vitamin D deficiency and deficiency symptoms. And that can lead to major health issues, ladies and gentlemen, especially with the cardiovascular disease, diabetes, autoimmune diseases, and even cancer. And why are we low in vitamin D? Well, we lack sun exposure and we use sunscreens. Now, if you get out into the sun without a sunscreen for 15 to 20 minutes a day, your body can make about 10,000 units of natural vitamin D. So most of us don't get out in the sun. If we do it, so we're only exposing our arms and our legs if we were golfing. So I propose that we have to supplement. And it's easy to supplement because there's a test out called the 25-hydroxy vitamin D test. And if you're over 50 in the result, you have a pretty good level. 80 is probably even better, but if you're over 50, That's a good primary goal. If you're 30 to 50, you should be supplementing. Maybe with vitamin D supplement, maybe adding vitamin D to your diet and the foods that you eat. And if you're less than 30, you're very deficiency and you need to take action. The sad part is when your doctor gets the result of a vitamin D, the normal level could be 30 to 80. And the physician assistant or nurse practitioner gives you a call, says, oh, your vitamin D level is fine, but you need to know the number, nanomoles per liter. But you don't have to even know that. You have to know that you want it 50 or better so that you do not get the symptoms that 40 to 80% of U.S. adults incur. We had a hit piece on melatonin a couple months ago, and now we have a little hit piece on vitamin D and dementia. But it was done by analyzing mice, transgenic mice. And they found that people with Alzheimer's disease had low levels. Well, was it caused by the Alzheimer's disease? Was it caused by the fact that they were not converting the inactive vitamin D they were taking to the active form, which has to occur in the liver? That's not in the report. But they did say, and it caught the reporter's attention, that Alzheimer's disease patients should not use vitamin D supplements. But they did not equate the active form of vitamin D3 with the inactive D supplements. And I'm not going to get into all that chemistry. And it was they initially checked these mice, and then they analyzed not patients but records. And came to this conclusion. But there's lots of causes for Alzheimer's disease and dementia, and we've talked about it on this program multiple times, like anticholinergic drugs, antihistamines, antidepressants can cause Alzheimer's disease. And if you just take away those medications, you get better. And the results observed in animals are not those that are actually seen in humans. In 2021, a group of physicians from Harvard Medical School concluded that inactive vitamin D supplement was not associated with cognitive decline. That's pretty good for me. As it turned out, over a period of 2 to 3 years, generally well-educated participants with supplements of vitamin D3 was unrelated to their cognitive decline. No correlated effects were observed in their verbal memory, executive functioning, attention, and overall cognitive functions. A slight benefit was noted in older Black individuals. In another study, over 7.8 years, 4,000 participants taking 400 international units of vitamin D3 and 1,000 milligrams of calcium per day, no association was observed between supplementation and cognitive impairment or dementia. And as I said, if you're low in vitamin D, you're more apt to have hypocalcemia, osteoporosis, rickets, osteomalacia, soft bones, and even psoriasis. So vitamin D does promote calcium absorption. It happens in our intestines. It's needed for bone growth. It's needed to remodel bone so that you heal from fractures. Without sufficient vitamin D, our bones become thin, brittle, and even deformed. Our muscles require vitamin D, and low vitamin D levels are associated with decreased muscle strength and weakness, and even pain. And vitamin D plays a role in reducing inflammation, and it is essential to neuromuscular and immune function and glucose metabolism. So if you stay indoors for long periods of time with little sunlight exposure, and who does that? Mainly the elderly. And also, as we get older, we have a decreased ability to synthesize this vitamin D. So vitamin D is necessary for our health. So it's dangerous if the concentration of our vitamin D is too low. And, just like everything else, we don't want it too high either. Therefore, you get the blood test is available. So these researchers from Taiwan really didn't do anybody a favor, because their methodology was not exposed. So you get your blood test, and you keep your level over 50, either by more sun exposure or supplementation. And as in previous podcasts, you need magnesium, right? You need to take a magnesium supplement along with the D3. You need vitamin K2, so that it does this vitamin D doesn't allow the calcium to go into your arteries. So with vitamin K2 and magnesium and a good diet, you'll be okay. So what foods have vitamin D? Well, halibut, mackerel, eel, wild caught salmon, not farm-raised salmon, sardines, pastured eggs, beef liver, raw milk. When's the last time you saw that? Caviar, mushrooms, especially the maitakes and the portobello, when they're exposed to the ultraviolet light. But vitamin D3 from animal products is the closest to the type of vitamin D3 produced in humans, and therefore the more active form, and believed to convert much faster to vitamin D2. And it's all over the place how much you need, okay? But it's easy to determine because there's a blood test for it. And you could take 5,000 units per day if you need it. In most cases now, there's little risk in oversupplementing. But there is a way to know what's best for you by getting your blood tested. And you may need a higher or lower dose than you're taking. You may need more sun exposure. You may need more sun exposure without a sunscreen. So I hope that clears it up for you a little bit. It does not cause dementia. Dementia and Alzheimer's is not a one cause only disease. It's a multifactorial. Many things can cause it. Maybe you're on a statin drug. That'll knock the heck out of your vitamin D3. And remember, there have been many analyses confirming that vitamin D defends you against, I can't even say the word, they'll take the show off, that virus that went around. I think my listeners know what I'm talking about. people that have adequate levels did not even go to the ICU. They did not have admissions to the ICU. There's really no question in my mind that you have to have an optimal amount of vitamin D3, not a normal amount, because a normal could be 30 or 40. You need to be 50 or more. And multiple studies have shown this. And there is a biochemical way that vitamin D works, because it boosts our overall immune function. And what have we been talking about for 2.5 years? That our gut immunity, 80% of our immunity is in our gut. And vitamin D boosts that, along with probiotics. And you know what? There was a study here, I don't have it in front of me, but vitamin D was effective in preventing the flu, more so than a flu shot. Now, if everything was ideal, the best way to get it would be, get sun on your bare skin. And the best absorption of vitamin D is when your shadow is smaller than you are. That's the best way to get biological health benefits and the production of it. But just remember, when you supplement, you must take magnesium and vitamin K2. Those three should be taken together. So the most critical factor is your blood level, not the dose you're taking. Again, I hope I'm making this clear to you. Because without the magnesium, your vitamin D supplementation may backfire on you. Without taking the extra K2, you may have complications associated with excessive calcification. And there's a large percentage of us that take vitamin D, right? But if you don't, you will not get significant benefit, because it will be stored in its inactive form, because if you're magnesium deficient. But again, you can measure this. Your doctor can order you a blood test. So I'm not going to go into all the chemistry of it, but just know that you need it. The studies show that the vitamin D deficiency causes a multitude of symptoms. And if you do have to supplement, if your blood test is lower than 50, then you must take magnesium and K2. And remember, vitamin D is a steroid. It's vital for the prevention of many diseases, including type 2 diabetes, age-related macular degeneration, which is now the leading cause of blindness. It's essential for Alzheimer's disease, heart disease, and many cancers. It's effective against pneumonia, colds, and flu. There are some physicians that I've been reading about that say if your vitamin D level is below 20, that you're definitely inadequate. Well, I think if you're below 30, if you have rheumatoid arthritis, you want to take vitamin D. Okay, one other thing was that there was an article about melatonin. Melatonin, another hormone produced by a pineal gland. And when does it start secreting it? Around 9 o'clock at night. So I've had listeners tell me that they're taking melatonin during the day. No, you want to take the melatonin when it is normally secreted by your body. And if you take it around 9 o'clock at night and don't watch television or use blue blocking lenses, if you do watch the tube, your body will know that it's time to go to bed. It'll know that bedtime is approaching, ladies and gentlemen. This will allow you to sleep at an ideal time. But you have to also be exposed to light throughout the day, okay? Because melatonin production depends on how much light your body absorbs. And if you stay awake past dark, these blue light devices, computers and televisions, hampers your body's ability to produce this melatonin. So you want to stop those gadgets about an hour before sleeping to help increase the melatonin production. You want to work with your body's rhythm. And I've told you, it is a great antioxidant, no doubt about it. And it definitely can protect against radiation disease, but you don't want to take melatonin during the day unless you're going to be having a CAT scan with a lot of radiation. And as we talked about, you can take 80 milligrams of it, but that shouldn't be the daily dose of it. And you should start low. You should start with a low dose. So there's a lot of people that say, well, you shouldn't be taking melatonin. Well, it's a normal hormone, and we don't live in an ideal world, and we are exposed to a lot of artificial blue light, especially at night from LEDs and so forth. And we don't get normal, regular sun exposure. Most people stay at their computer all day long. So when nighttime comes, your pineal gland doesn't know what to do. So you don't get the correct melatonin production or even a decreased melatonin production. I've been telling you for years, please turn off your wireless router, your wireless printer, and wireless devices before you go to bed. If you have to watch that one show, use the blue light blocking glasses. And grass-fed meat has melatonin. Wild-caught salmon, here we go again. Raw grass-fed milk, pineapples, bananas, pomegranates, grapes. And you could look this up. Tomatoes. But remember, you can supplement. There's no toxic dose. I mean, Dr. Steven Sinatra has had many discussions about this. And there's many studies showing that it may help you improve your sleep quality. And it can improve your overall health because it is a hormone. It can act as an antioxidant and fight those free radicals, especially when exposed to radiation. Melatonin can help insomnia, jet lag, heart disease, menopause symptoms, fibromyalgia, and tinnitus. But if you're on anticoagulants and antiplatelet drugs, drugs, do not take melatonin. If you're on anticonvulsants, contraceptive drugs, diabetes medications, immunosuppressants, and probably shouldn't take it if you're pregnant because there's not a lot of study in that field. I wouldn't give it to children or babies. Not enough studies being done on it. So if you're taking melatonin during the day and you're sleepy during the day, well, hey, there's your answer. If you find yourself irritable during the day, you shouldn't be taking that melatonin during the day. Your body doesn't produce it normally during the day. If you find yourself getting confused during the day, it may be because you have too much melatonin, not because you have Alzheimer's or dementia. You've just disrupted your body's clock, the normal rhythm of your body, because you don't make melatonin during the day. And last thing about melatonin, please don't take it with alcohol. Okay, because of its sedative. They both can make us too sedate and not mentally active enough. And it takes about 20 minutes for it to work. That's why this 9 o'clock time has come up. So maybe 9 o'clock, it takes 20 minutes. Some people may take a little longer. You're going to have to experiment with that, but you don't want to take it during the day. That's the message. Okay, so we want you to work with your body. We want you to take that thyroid hormone in the body. When your body normally excretes thyroid in the morning, you want to take it on an empty stomach. And if you're not, your blood tests are still coming back abnormal and you're sick and tired of being sick and tired, your physician or health practitioner should know to order the correct blood test, including a reverse T3, which is really a measure of how much inflammation your body has. And it's destroying the active thyroid. And lastly, but not leastly, ladies and gentlemen, you want to try to look for solutions within you. Don't let money dictate your life. And do you believe that everything happens for a reason? Happy people tend to trust the process and everything in their lives. They know that nothing is ever too big to handle, and they embrace what life is currently throwing at them. And they get rid of that self-pity. Hard thing to do, but happy people and healthy people live in the present. Tough to do. So you got to appreciate those moments of relaxation. Don't be distracted. Try not to dwell on being a victim. Whether it's a breakup, or losing your job, domestic abuse. I know it's tough, but if you really want to be happy, you can't dwell on that. Just let them make you stronger and get on with your life. And love yourself for who you are, right? You are what you are. Love that. It's not egotistical to love yourself. Be comfortable in your own shoes. Don't wallow in what others would define you. That's what happy people do. Happy people are healthy people. Happy, healthy, horny, and high, as we say, the 4 H's. Happy people won't talk about this. They just do it. So don't be afraid of vitamin D. Don't be afraid of melatonin. Know that to work with your body, I think you'll be okay. All right, that's all I have for today, ladies and gentlemen. I hope you've enjoyed this. I hope you act on the advice you just heard. And let's get on with our lives. And I will see you next week with another tip. And then a big show on Parkinson's disease. Stay tuned for that. Okay, we'll see you next week. Thank you.
Hey everybody, Dr. Ron's finished for today. I hope you got some good wisdom for what the man had to say. If it's all about good health, he's the man you got to see. He has a lot more answers for you. So tune in next week when the doctor is in the house. Or when the doctor is in the house. Let the doctor know what's bothering you. When the doctor is in the house. The doctor is in the house. Doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. When the doctor is in the house. So if you have a pain, call the doctor. If you have a strain, call the doctor. Let the doctor know what's bothering you. When the doctor is in the house. The doctor is in the house. See you next week.